I became aware of the autism crisis in America when my grandson, Christian, became autistic shortly after getting about 9 shots, 7 of which contained mercury, and he became autistic in just a few days. And I was chairman of the Government Reform and Oversight Committee in the Congress, and we have oversight over the whole government, so I could have hearings on any subject of any agency. And so I started having hearings on Health and Human Services and the Food and Drug Administration to find out, why there was mercury in vaccines, and was it necessary, and didn't they know that that's a contributing factor to neurological problems. And so that's how it all started.
That's interesting. Can you discuss the socioeconomic and financial impact of the autism epidemic?
Well, first of all, the young people who get a severe case of autism, which is many, many of them, they're going to live a long life in most cases. It's not like a terminal disease where they die in a short period of time, which means simply that as far as the government of the United States and the taxpayers are concerned, many of these people are going to become dependent on the government in addition to their families for support at some point. The families, many people have mortgaged their homes, lost their homes, spent all their money trying to save their child from the ravages of autism, and there's a limit to how much they can do. And the kids, when they grow up, many become violent and can't live with their parents, although most of the parents try to keep them with them. And they're going to be a burden on the system, the taxpayers. And with the hundreds of thousands of children that have been adversely affected by mercury and vaccines, we're going to have a huge number of kids that will be adults that will be dependent in one way or another on the government for their existence. And this is going to be an additional cost to Medicaid and all the other agencies of government. So that's one of the reasons why we need to get mercury out of all vaccines, adult and children vaccines, so that neurological problems caused by the mercury in those vaccines can be eliminated, and thus we wouldn't have a problem down the road.
We speak to a lot of people at the state level as well and in education, and most of them believe that the mercury is out of the vaccines, and most of them don't really grasp the cost of, say, $5 million over a lifetime to care for one of these kids, times the 4 million or so in the country right now. If you were speaking to a group of legislators, what would you tell them about the severity of the impact of this?
Well, I have. I talked here in the Indiana General Assembly about the necessity to use Medicaid funds to help parents who had autistic children, and I don't know if it's still being done, but they passed legislation which did provide for a lot of the families with children with autism to get help through Medicaid. But when I talk to legislators, when I talk to congressmen from around the country, I stress that this is going to be a huge financial problem and burden on the government, i.e. the taxpayers of this country, long term, because it costs, like you said, about $5 million a year over the lifetime for a child that has autism. And when you multiply that times the number of children that are going to be adults that have autism, it's going to be huge.
Sure, and that goes into the trillions of dollars. When you were the chairman of the Committee on Government Reform, you conducted, I think it was a 3-year investigation into pediatric vaccines and the autism epidemic. What were some of the committee's findings and conclusions that parents, health professionals, and other legislators throughout the country would be interested in knowing?
Well, first of all, mercury is toxic to the human neurological system. There's no question about that. We had a spill out here in Franklin Township in my district where firemen went in and there was a very small spill of mercury. They went in with uniforms that looked like spacesuits to clean it up. We had a fire in Washington. We had a chemistry lab in Washington where they spilled a small vial of mercury, and they took the children's clothes and burned them and got rid of them, and they cleaned up the lab work there to make absolutely sure there was no problem because of the neurological impact of mercury. And yet, mercury has been and still is in adult vaccines and in some of the children's vaccines. We've been able to get it out of a lot of them, but it's still in some of the children's vaccines. And there's no question in my mind that things like autism and Alzheimer's and other neurological problems are caused in part by the mercury in these vaccines. And that's why during the years that we had those hearings, those 3 years, we had experts from all over the world come in, doctors, scientists, and they convinced me and the committee that this was one of the contributing factors to the epidemic of autism. So, you know, there's no doubt in my mind that that's the case.
One of the issues with parents seems to be that they're being stonewalled when they try to track their vaccine lot numbers to verify, say, how much mercury they did get in their vaccines and so on. There's a couple organizations that they probably could get some help with. Can you explain what VAERS is and how there's no oversight or enforcement of this FDA and CDC run program?
Well, the Vaccine Injury Compensation Fund you're talking about is a fund that was set up to protect the pharmaceutical industry from class action lawsuits from pharmaceutical products in exchange for setting up this fund, putting so much money in a vaccine fund to take care of people, parents and children who've been damaged by the vaccines. Very little is ever paid out of that. It was supposed to be a non-confrontational fund where people could go if they could show that there was a damage caused by these vaccines and get their children some funds to take care of them. But it's become very confrontational. They have to go through a very long legal process. They have to have a special master look at it. The Justice Department, they have a guy there that reviews it. And so very few people have gotten any money out of that fund. And the last time I checked, there were about $3 billion in the fund. And my suggestion to the pharmaceutical companies who are still worried about being sued in class action lawsuits because of the mercury in the vaccines and the damage, I said, look, we'll go so far as to say we'll give you protection against these suits in exchange for you putting additional monies into the Vaccine Injury Compensation Fund, and then making it easier, much easier for parents who have damaged children to get access to those funds to take care of their kids and to make the quality of life better. But so far we have not been able to get the pharmaceutical companies or the Food and Drug Administration to take any steps to do that. We've gone so far as to say, okay, we'll try to protect you. We need pharmaceutical companies to come up with new technologies, new vaccines, and new things to help the people of this world and this country. But you can't damage people and get away with it scot-free. So we're saying put more money into the Vaccine Injury Compensation Fund, which would be paid for by the people getting the vaccination, no doubt. And we'll, as long as the fund is user-friendly, we'll try to make sure that you guys are protected.
Okay, but you're more or less saying that the pharmaceutical industry is more or less protected by federal legislation right now.
The Food and Drug Administration, in my opinion, is aware. There's been an IOM study that shows that the mercury in vaccines is very likely to be a cause of some of the neurological problems. But they also had another IOM report that said that they could not conclusively prove that the mercury in the vaccines were causing it. So there was an escape hatch there. And the FDA has been, in my opinion, complicit with the IOM and other doctors who and people who have a vested interest in this issue to protect the pharmaceutical industry from lawsuits that might cause them severe harm. The bottom line is that I believe that there is a connection, I don't know exactly how it works, but a connection between some people at the FDA and these other agencies that are making decisions on the vaccines and the mercury in them, and the pharmaceutical industry.
Okay. What can parents, grandparents, etc. do to truly affect change in national politics on the autism issue?
They need to contact their congressmen and their senators and tell them that it's imperative that the pharmaceutical industry get mercury out of all vaccines. You can go to single-shot vials. They say mercury is a preservative. The thimerosal is a preservative. They can go to single-shot vials. Doesn't need the thimerosal or any kind of preservative like that. And you can eliminate mercury from all vaccines. It might cost a penny more per vaccination, but the fact of the matter is it will protect the people against mercury toxicity and mercury damage to the neurological system from the vaccinations. And that's something that needs to be done. And they need to call their congressmen, their senators, and anybody else that has influence to say legislation needs to be passed to get this done.
I know H.R. 881 had well over 100 votes in the Congress, but Chuck Hagel introduced the same exact bill in the Senate, which failed to get one co-sponsor. Do we have, how would you suggest that we get senators on board with this as well? None of them, they seem to have all stonewalled this whole issue.
The pharmaceutical industry in Washington, D.C. has a huge amount of influence. They have over 600 lobbyists, probably more like 700 or 800. They have more lobbyists than we have members of Congress in both the House and Senate. We have 535 members of the House and Senate. So, you know, and they spend hundreds of millions of dollars over the course of time in lobbying against many of the changes that I believe, and many of my colleagues believe, is absolutely necessary for the safety of the American public. And I think that's one of the reasons why they've been able to convince many senators and congressmen that this is not really an issue. It is an issue. Mercury needs to be taken out of anything that goes into the human body.
But how do they stand by them comments knowing that this mercury preservative in the vaccines has never undergone any testing? Can you elaborate on that? A lot of times when the parents mention it, they look at them like they're loons.
In the late 1920s, this was tested, the thimerosal was tested on 27 or 28 people that had meningitis. All of the people died from meningitis, but they said the thimerosal had no impact on their dying. And so that was the only quote-unquote test that was ever given. Thimerosal has never been tested as far as mercury toxicity is to the human neurological system. And yet it's been used since the 30s. It was in methylate. It was in other optic solutions, and they've taken it out of almost all of those, and yet they left it in vaccines as a preservative. It's really tragic. And the FDA, according to the studies that have been done and the hearings we had, there's no doubt in my mind that they know that mercury is a problem.
Okay. Do you think that efforts to help these kids, and with a lot of the state bans on mercury, such as in my state of New York recently, are the efforts to help these kids more fruitful at the state level, being how hard it is to get things done in Washington?
Well, you know, I think California has taken steps to deal with this problem. New York has. And I would say to state legislators around the country, if the federal government has been quote unquote too heavily influenced by the pharmaceutical industry, that the states ought to take the bull by the horns and pass legislation mandating that mercury be taken out of the vaccines at the state level. And that might end up in the courts, but at least it will draw a great deal more attention to the problem, and ultimately we'll get it solved.
Okay. So do you think there's anything that states, what can states achieve realistically that is very difficult to achieve in Washington, D.C. besides the mercury with the other autism issues in the big picture?
Well, they can through the Medicaid system, they can help with some of the treatments and medications that children with autism need. The state legislatures, if they so chose to do it, they could appropriate monies to take care of the people who've been damaged by the mercury in the vaccines. But most of the states in that regard would probably say that's a federal issue because the FDA is a federal agency that allows these things to go on. And so they probably say the financial problem should be solved at the federal level. And I would agree with that. I think the Vaccine Injury Compensation Fund, which was created in the late 80s, was designed to deal with this problem. But it's become too confrontational. And parents who have autistic kids and try to make their case before the special master haven't been able to do it. And very, very few people have collected anything out of that fund. And as I said before, it's got about a $3 billion surplus in it.
How can the autism advocacy community work better with legislators to get what we need to help our children and families?
It's a very difficult problem. You have to keep lobbying. That means calling your senators, calling your congressmen, calling your state legislators, telling them of the problem, asking them what they can do or will they do something about it. Tell them of the plight of the family because of the damage done to the child. And just keep beating on the issue. I believe ultimately we'll win this battle. But how many hundreds of thousands or millions of people are going to be damaged by the mercury in vaccines before we get it done is going to be, I mean, it's going to be a shame. But I believe eventually we'll make our case.
Actually, kind of a two-part question of what have the autism advocate groups done right, and what have the autism advocate groups done wrong or not succeeded in?
What they have done right is that they've started lobbying, they've started bringing to the attention of legislators and government officials the problems caused by the mercury in the vaccines and the autism epidemic. What they've done wrong is they haven't been able to convince enough of their fellow citizens to raise Cain with the legislators in Washington to bring about change. We need a massive public relations campaign to convince legislators that this has to be done, that mercury is toxic, it has to be taken out of vaccines, the Vaccine Injury Compensation Fund needs to become more user-friendly, and we've got to do something to stop the increase in autism, and we've got to do something to make sure those who've been damaged are compensated. And that means we have to have a lot of people involved. So people that have children that are autistic or know people that are autistic, they need to get together and start forming organizations in each state, each city around this country, and keep putting pressure. Political pressure will bring about positive change. That's the one thing I'm sure of.
Can I ask you briefly about the Combating Autism Act, what was just recently signed into law? You had commented publicly and about the positive aspects of the bill. I know you would have wanted much more in that bill, but can we still turn the Combating Autism Act bill around to include immediate help for families in schools? There seemed to be limited funding for immediate help for families in schools in that bill.
Well, for children who have learning disabilities, there's supposed to be, we appropriate money from the federal level to the states to deal with that. And the states have not been getting enough money. There's more children with disabilities than there is money to take care of them. That's one of the problems the states are facing. We're only funding that part of the government, if you will, you know, helping kids with learning disabilities at the state level to the tune of about 40%. We promised we'd do it at 100% level, and we've only done it at 40%. So the federal government needs to do more, and we'll be pushing them to do more. But so far they haven't lived up to the commitment, financial commitment they should have.
We were talking about the Combating Autism Act earlier, and one of the things that wasn't included was the research funding that got pulled for vaccine safety and environmental causes of autism. How can advocates plan effectively to ensure that the Appropriations Committee funds these vital areas?
Well, the only way you can do it, especially at a time like we're in right now where it's a fiscally tight time, is for them to stay on their congressmen and senators and stay on the people on the Appropriations Committee. They need to contact those people and tell them how important the issue is and be personal with them, tell them about their families. And,
okay.
Yeah.
What will be the autism community's challenges in working with the new Congress and, say, specifically maybe Reform Committee Chair Henry Waxman?
Well, Henry, I think he has a different view on autism and the reasons for it. I don't know that, I mean, I don't think he'll be nearly as aggressive as I was as chairman in trying to get to the bottom of the issue. So, you know, what needs to be done is people need to be diligent. They need to be very diligent in contacting congressmen and senators and keep telling them my family's been horribly damaged. And even come to Washington and talk to congressmen and senators, and you know, it's a tough process.
Can you talk to us briefly about your Republican colleague, Dave Weldon, his involvement in autism issues and his qualifications to speak on them?
Dave Weldon is a very fine fellow. He's a doctor, as you know, and he was one of the people that was on my committee when I was chairman. And I think he became convinced through the hearings that this was a problem. And so David has taken the initiative to sponsor legislation dealing with autism, which I have co-sponsored, And I'm very happy that he's jumped into the fight and is doing such a great job. I'm for vaccinations will prevent any kind of disease, but I do believe that we ought to take into consideration what's in the vaccine besides the thing that's going to help. And if there's mercury in the vaccines, it ought to be taken out. I personally believe that the increase in Alzheimer's and other senior citizens' neurological problems is caused in part by the mercury in the vaccines. I don't think it's just children with autism that are being affected. But I would just say this. Any vaccine should be properly tested. The rotoshield virus vaccine, they ran it through their advisory committee. The advisory committees are made up of doctors and people with medical experience, and they're supposed to not have any interest in the vaccination involved. We have found in many cases, including the rotoshield vaccine that was given to babies and children, that it wasn't properly tested, and yet it was put on the market because the advisory committee recommended it. Now, the advisory committees are supposed to be just that, but if they recommend it, the FDA almost always, in my opinion, approves it. And so the rotoshield vaccination was put on the market. Some children died, many became ill with it, and they took it off the market in less than a year. That shouldn't happen. And that happened because it was not thoroughly tested.
Are some of those folks on the advisory committee former executives and people from the pharmaceutical industry that are actually pushing a lot of these vaccines?
Every advisory committee has different people on it. If all the people on the advisory committee don't show up, many times they'll bring people in from the FDA to help with the determination on whether the vaccination should be put on the market. I think all that should be changed, and I brought that out when I was chairman. Advisory committees should be made up of people who do not have a vested interest in any way in a proposed vaccine. If they do have a vested interest, and the guy that was the chairman of that committee I just talked about, the rotoshield vaccine, I understood that he had interest in a company that was manufacturing a separate rotoshield vaccine. So, you know, there was a question about whether or not he was being impressed or influenced by that. So I think everybody on an advisory committee that recommends things to the FDA we should have a financial statement from them. We should know for sure that they don't have any financial interest in the company. Congressmen have to do that. We have to disclose our financial interests. And I don't know why people who are making decisions that affect millions of Americans should be any different.
How do you think the mainstream media has handled this issue? Do you think they will not address it fairly for fear of hurting their advertisers, being that they get such a large percentage of their revenues from the pharmaceutical industry?
You know, the pharmaceutical industry advertises a tremendous amount on television, and I don't know how much they do in the print media, but on television you see advertisements for Viagra and Cialis and all these male-enhancing drugs almost every 5 minutes, and you see advertisements for all kinds of drugs every 5 minutes. Many people in Congress, myself included, think that a lot of that money that's being spent on those things, asking people to call their doctor and ask for these things, should be left up to the physician. I mean, they're lobbied by the pharmaceutical companies, and this money that's being spent, this multi-million dollars, maybe billions of dollars that's being spent on advertising for these products, would be better left to research and development and making sure that we had vaccines that were completely free of things like mercury. So, you know, but I can't tell the pharmaceutical companies how to advertise. That's not my place. But it just seems to me and many other members of Congress that's something that they should consider.
Okay. What do you say to those who say autism is just strictly genetic and that there are no other triggers involved?
Baloney.
Okay. Good one-word answer. I like that.
I would use stronger language, but baloney is sufficient.
Is there anything that you would like to say to legislators and people in education about autism that maybe you haven't shared with us during this interview so far?
I think the whole population, educators, scientists, doctors. We have doctors that have autistic kids who are very concerned about the mercury in vaccines. It's not limited to people who aren't physicians. But we have educators, doctors, lawyers, people, average citizens. all of us are going to be affected by autism eventually. Because once these people, these hundreds of thousands of children that have autism, once the parents are no longer able to financially support them, they're going to be a burden on society. You can't just put them out on the street. And the taxpayers are going to pick up an awful lot of these expenses, and it's going to be a tremendous additional burden on the budget of the United States and state budgets. And so it's to everybody's advantage to get the mercury out of vaccines and make sure vaccines are properly tested before they are put into the marketplace.